My name is Terima, and as Dr. Emilia already introduced me, I'm a dermatologist, venereologist, allergologist, and I started with the aesthetics about 10 years ago. And I did my training with other big companies, and since 2 years I'm using the Cellbooster from Swisscell, and I'm really happy about the results and also that they deliver. And what's for me really important is that there is scientific backup behind. No? And the most important thing is the CHAC technology. You might have heard about it, and CHAC is an acronym standing for cross-linked hyaluronic acid complex. It might be misleading a little bit because there's no chemical bindings in it, so the cross-linking is only physical. So that's really important for you to know. So there's no likelihood of any granulomas happening after injection because the hyaluronic acid doesn't contain any chemical bindings. So this is really the important thing, and the blend of the CHAC technology is just like to enclose and encapsulate the active ingredients of amino acids, micronutrients, so to have a better effect on the skin. So, as I told you, it's proven by clinical trials, it's Swiss made, so it's really a high class quality product. It's a unique formula that doesn't exist yet on the market with other kind of brands, and you can inject it with all the other products in the range. So you can combine lift and glow, lift and shape, shape and hair. So it's all possible with one patient to inject all of the range and to achieve really long-lasting results and have a really good feeling also about it because it's safe for the product, it's safe for the patient, and for you it's really easy to inject. So this you know already, it's not a meso, no? Because Cellbooster has an effect on the cells of the skin. So the hyaluronic acid, which is inside here, is just a high molecular weight hyaluronic acid using as a vector. So it's a vector bringing all the vitamins deep inside of the skin on a cellular level to level up your game also by bringing beauty to the patient. So the CHAC technology, it is really something special, and it doesn't exist on the market other than with Swisscell. And this is really a good thing to have a combination which is stabilized. And this stabilization is something unique because it saves the hyaluronic acid from degradation. And this is a slide just to show you how this CHAC technology works. I know there's a lot of pictures and it might be a little bit complicated to see, but the most important thing is it's not a mixture which is just done by adding something together. This mixture is done in a solid state, and by opening up the hyaluronic acid helix, it encloses. It's like a tight hug that you would have, and this tight hug stands for the hyaluronic acid that encloses the micronutrients and the vitamins inside of its helix, and thus stabilized hyaluronic acid is not degraded so fast. And by putting it then into the liquid phase, we have a really more stabilized hyaluronic acid which doesn't degrade that fast because the hyaluronidase doesn't register it so fast. So again, high molecular weight hyaluronic acid. This is really important, and I will stress it later on with another slide to show you what are the benefits of the high molecular weight. Then this complex, which is definitely a distribution possible, and it doesn't degrade that fast, and you have a slow and gradual release. So one by one, the ingredients are released and then having a really good effect on the skin. About the benefits of the CHAC technology. What happens when we age? So this is something, when we are younger, our skin is tight. Our skin doesn't have any kind of pigment issues. Our skin is not red, and we have less wrinkles. But radiation, the pollutants, and also the chemical stress that is brought into our skin brings us to age. And then we develop this kind of wrinkles, we lose the elasticity of the skin, and by thus we're having less of hyaluronic acid also in our dermal area. And so bringing that back and bringing also it back with the fillers, that was an aim like for the past 10 years, But the problem is that if we overfill these faces, we get really distorted faces, and normally people don't want that anymore. In Europe, there's a trend of going back to the natural self, but no one wants to age. So in a way, you have to find a bit of a place there, and this is where Cellbooster comes in, by having a really, really good effect on the skin and by creating the structure back in the skin. And this is done mainly by the hyaluronic acid, but with the encapsulated system. So think of the tight hug of the amino acids and the micronutrients that are released slowly inside of the skin. And you can see everything that we inject also builds up collagen. So this is one part of the game, but with the factors that are inside, you also protect the epidermal integrity, you induce wound repair and wound healing, and you also have a regenerative activity with the hyaluronic acid, and mainly the high molecular weight hyaluronic acid is something that is beneficial for our skin. Low molecular weight hyaluronic acid is a danger signal of our body, and then in the end it turns into some negative effects. But with the high molecular weight hyaluronic acid, we have positive effects of anti-aging, antioxidants, and also less inflammation in our body. So this is the CHAC technology. Again, show you how it works. And what's the most important thing is here, that it is enclosed. So I will show you that the integration and the stabilization has a longer lasting effect because it doesn't degrade that fast. And this is really the important thing about this CHAC technology. You have an ongoing process, and you have like a slow release of the micronutrients and of the amino acids to have a beneficial effect for your patients. So I'm just going to go on and about the beauty standards. So everything is about proportion, yes, everything is about relations, but the thing is that in the end, a perfect proportion doesn't bring you a nice overview. So in the end, for me as a dermatologist, the most important thing is the skin quality. And I'm happy that the aesthetic medicine moves into that direction, because you can fill the skin up, but if you have bad skin quality, if you have acne scars which are still visible, it's still not nice. And so in the end, you have to find something that is reflecting also this kind of options. Here, it stresses the distinction between the products that are on the market yet with the Cellbooster. And again, remember the CHAC technology as a tight hug. So you still have the micronutrients which are enclosed within the hyaluronic acid helix, and with the other products, you have them floating around the hyaluronic acid. So the degradation of the hyaluronic acid is faster here, and the micronutrients may or may not work because they will be brought inside of the skin and then be brought outside again. And here, with a combination and with a complex, you have a longer lasting result by slowly releasing it sequentially. With the HA fillers, the combination of Cellbooster is always something that is possible. But with the HA fillers, you fill it up. You create some kind of volume which might be distorting. But if you combine it, for example, you have really beneficial effects. And if you just use the full range of the Cellboosters, you can promote different kind of advantages within. So with the shape, you will have the reduction of the adipocytes. You have a lymphatic drainage. You will have less of a swelling in the face. With the lift, you will address the acne scars. With the glow, actively reduce the pigmentation, where it's also study-based. And with the hair, you will have a beneficial effect for the hair follicles and for the scalp. The advantages of the CHAC technology: so no chemical bindings, no vascular compromise possible, gradual and optimal release of the ingredients, combination that is prone to be combined with other treatments. So these are the main advantages of the CHAC technology, and these are the main advantages of the Cellbooster range. Here again, the full range of the 4 products. Each product can be combined within each other. So you can use all the products in one patient. This is easy and fine, and you will have different kind of options. And this is also what I like about the product line. You will have, for each product, one kind of diagnosis which you can promote and which you can therapy. Good. So let's start with the range. No? I think you know already about the Cellbooster Lift. No? The Cellbooster Lift is one product that you can use with everyone. So it's mainly to stimulate the collagen production and also by improving the microcirculation, and this has also been proven by studies. But this is perfect product, for example, also for oxidative stress and for inflammation. So you can use it for older people, for younger people to preserve their beauty, for older people to get the density back in their skin, but also for acne scars. This is the perfect go-to product, and this is something which you can use and have a really nice effect. Here it says also where you can use it. I use it everywhere with my patients, mainly sure in the face because that's why they come, but you could use it in the hands, you can use it on the neck, you can use it on the décolletage, you can use it on the body. It's fine, this is definitely possible. And here you can see the effects on the dermis and on the epidermis as well. So you see the micronutrients, you see the amino acids, and everything that is common with all the lines is all of the range of the Cellbooster has this high molecular weight hyaluronic acid. Imagine that it is like a taxi, like a vector bringing all the good stuff deep inside of the skin. This is how this complex is helping to renew the skin, and with the lift you need to know your depth where you're injecting. So if you want to reduce the acne scars, you have to better bring it in by a cannula, bringing into the deep dermal area where the structure is missing, and also to build up that structure. And with the acne scars, you have the tissue going down and stretching the skin. And by cannula, you can first do the subcision to bring that out and to lessen this kind of structural support, and then you will have a better effect on the skin. This is the study proven that the clinical trials and also the evidence that this cocktail of lift works really, really fine. And here it has been shown that the effectiveness has been there, and this is really something that is really unique with a product like this, because there's no other real good comparative to this kind of product on the market. And Swissell gave so much effort in doing this kind of research for you, so that you can definitely say with pride, this is a good product and I can use it on my patients to also have really good results. Here you see the results of the study. And which is really, really important and to stress is the microcirculation, because the more blood flow that is there in the skin, the better it can renew itself. And you can see here that the patients and the investigators were really happy about the result. So it's satisfying for both of them, for us as injectors, but also for patients for the results. And you can see also the skin density, which is for me the second most important thing, that the density of the skin is getting better. So microcirculation, skin density, and we're all happy. Patient is happy, we are happy, and this is a good, perfect result. You already get that after the first injection, but I would advise you for optimal results to follow this protocol. Do 3 treatments with 2 weeks interval for the optimal results. And the maintaining injections depends a little bit on what you want to achieve, and you can go on with this cycle forever to maintain this kind of effect, but you will definitely see already results after 3 months because you stimulate the collagen growth. And this is what we do with the biostimulators, this is what we do with the hyaluronic acid. So this is something that you can go on and on and on. So you can inject it by cannula, you can inject it by a needle, you can inject it retrograde, you can inject it linear anterograde. in a way, it doesn't matter. It just matters what you want to do. No? Because if you want to reduce the acne scars, I would definitely go in with a cannula. If you are more reducing the wrinkles on the neck and décolletage, you can use the fanning technique and the papular technique on top of each other. You can use different kind of options. I think it's a little bit on how you feel comfortable, but the important thing is that to know what you are doing and how deep you need to put it. No? Here you can see it, and you can also see it later with the model I'm going to inject. So mark the parts, make 1 centimeter small squares, inject 0.1 per point, and then you will have a really, really nice result. And then you will see you will have nice results for you as well, and also for the patient. And if you want to do the subcision, use a cannula, deep injection, and then you will have a nice result as well. Also by this fanning technique, for example, also possible on the neck and décolletage area. It depends a little bit on what you want to achieve and where the localization is, and then you can adapt your technique to it. Here are the pictures from the study. So you can see, for example, that the skin texture has changed because you can see it with the pores here versus here, and also the shininess of the skin has changed, and also the pigmentation has evolved, and this is something what you can achieve with this kind of injections, and this is something really, really nice. Same here also with male patients. So you don't have to only, because most of the times in my practice, female patients come in and ask for different kind of rejuvenating therapies, and male only come in for the toxin. But you can always tell your male patients as well, we have something where you don't look treated, because no one wants to look done. And this is something where they go out of the praxis and no one will see it, but they will be really happy about the results. And this is something where we maybe also need to break a thing. And for example, here my patient, she's a heavy smoker, and I told her, please stop smoking. And she came for me and wanted only the toxin in that area. So she wanted the frown line to go away, and also these small lines around her mouth. That was what's bothering her. And I told her, let's do a fractional laser, let's do the Cellbooster. And she declined to do the laser because she didn't want to have a downtime. And then I told her, you know what, let's do this treatment, and let's do the full 3 treatments in a row to have a really nice result. And here you can see how after the 3 treatments, how the skin has evolved over time. And this is something really nice because she was really hesitant to tell anyone that she's getting something done. And she still looks like herself, but like a younger version of herself. And this is what the trend in Europe is going. So people want to look natural, but the problem is we age every day, so we need to do something, and this product is just boosting our own immune system. Here, for example, with my patient, you might feel like, okay, there's not a big difference, but here with the combination of glow and lift, which I did, you can see that the pigmentation has become better here in the cheekbones. You can see that this deeper smile line has improved by only injecting Cellbooster. No other kind of fillers were done with her. And the next step, what I want to do with her, is to improve her double chin and her jawline by injecting then the shape. And you can see here, even after, because this was in summer when we did the treatment, and you can see that she even got a little bit of a tan and redness, but still her skin looks so much smoother and so much better. And even here from the other side, you can see the reduction of the pigmentation on the after pictures. Striae really is something that we can only stress out to seek therapies for this, because many people who are suffering of that because they lost weight and then they have this kind of striae everywhere, or for example pregnant women after giving birth. This is something that I'm just stressing. Use the Cellbooster lift. Go with the papular technique inside of these striae, and you will see they are disappearing over time and they're getting better and better. Good. So here again, a before-after Cellbooster lift. Here, for example, also with patients around that area with the acne scars. So this is really something that you can just really do and really have nice results. And here is also for the skin texture, it's improving over time. For the belly button, you can use it. You can use it, as I told you, the lift is an overall product which you can use anywhere. The glow, I love it because it's just like something improving the redness and also the pigmentation in the areas. And I will show you why it's working like that, because it contains glutathione, which is a high antioxidative treatment, and the vitamin C. And by this, it stops the pigmentation on 2 levels of the melanin production, and by also the anti-inflammatory amino acids and also the hyaluronic acid, it's really something that is really a nice, it has effect. You can definitely have a better effect than, for example, with the peeling, and because after the peeling, the patients need to avoid the sun, but with this treatment, it's just like definitely a better hyperpigmentation reduction from within. Again, same schedule, 3 times with 2 weeks interval. And as I said before, you can use it also on the body. And again, same technique options. The importance here is try to know what you want to achieve. If you want to achieve the pigmentation, go intradermally. If you want to take away the redness, you have to go deeper in the mid-dermal or deep dermal area. So this is really the important thing, because then you can definitely have better results with your patients. Here again, you can mark it. Here, for example, a patient of mine, here you can see the reduction of the pigmentation, but look at the small lines around his eyes. So they also are just like a beneficial effect on that by reducing this as well without using any toxin with a male patient. So this is really something. And here, for example, I injected my fellow colleague in the clinic, and you can see what you can do. You can go directly really close to the eye. Even on the upper eyelid, you can use it. And the glow is also perfect to reduce this excessive pigmentation you see here. It's definitely a lot lighter after the treatment. And for example, here you have the reduction of the pigmentation and the reduction of the smile lines as well in one go. So this is really something that is really nice. Here, in this case, for example, telangiectatic rosacea, reduction of this facial erythema, you can see it's definitely a lot lighter, but the problem is that telangiectasia, it doesn't respond to it. So you need to bring a little bit of energy, and either you do it with a neodymium yak or you do it with an IPL, depending on the skin type, and then you have really nice results. And here, for example, with the acne, so it's really good. Even with active acne, you can use the glow, and it really will deliver really nice results. Here also some pictures of fellow colleagues where you see that the pigmentation, not only the pigmentation, but also these small fine lines have improved after the treatment. Same here with my colleague. So it's just like really nice treatment. It's not perfection in one go, but you can see if you would go on and on, it will get better over time, definitely. And here as well, and here as well. So in her case, for example, I would definitely maybe also aim for a deeper injection of the lift to reduce these small acne scars as well. Here, for example, also nice reduction of the pigmentation in the face, and the face relief is definitely getting better. Shape. Shape is something really that also you can use with almost with every patient. It doesn't only reduce the fat and the double chin, it is also helping to drain the lymphatic tissue. And this is something that is really beneficial, because sometimes you have overtreated patients after filler blocking the lymphatic drainage, and then you want to get rid of that. But the problem is that you cannot use a lipolytic in the whole face. With Shape you can, because it's not a lipolytic. So this is also something that is really important. And what does Shape do? It mobilizes the fat. So once you inject it inside of the fat tissue, the L-carnitine and the vitamin C will help to burn the fat away. So it curbs your metabolism to burn the fat away in your own mitochondria. So it doesn't destroy the adipocytes. It helps to bring them into the mitochondrial area, so you have an oxidation of the fat, meaning that you burn the fat away. And it doesn't only burn the fat, it will produce it into energy, and thus reducing it. And this is really something important where you can definitely have a nice effect. So the thing is the adipocytes also change as we age. And so in the end, it's just like they get altered and the metabolism is not active anymore, and that's just why we develop this stubborn fat which doesn't go away if we train or if we fast. And this is something where we can use it with a lot of patients, and we can get nice results with it as well. Thing with the lipid reduction now, there are so many things on the market, and the cryolipolysis doesn't deliver really nice results for all over the time. And the lipolytic is causing destruction of the adipocytes, and when you place it in the wrong area, the problem is that you can also harm the muscle cells, you can also harm the skin cells, and in the end you will develop really unnice results. And this is something that cannot happen with the shape. And this is really the important thing. So by killing the adipocytes, you will have an unhealthy cytoplasm components, and this is something that will be pro-inflammatory, and this is definitely not a good thing to have. And with the Cellbooster shape, you will only restore the physiological metabolism, and by thus reducing the fat in a normal way. And the good thing what I was stressing about is the lymphatic drainage. So the carnitine and the vitamin C will enhance lymphanginesis and will be lymphotonic and venotonic as well. So they will drain the excessive fluids and the edema out of the face and of the area where you inject it. Always think about where the lymph nodules are. So inject it in a way so that the body is possible to follow the path where you have the lymph nodes to have a really good results with that as well. Again, you recognize the pattern, 3 injections, 2 weeks interval, really easy. And again, you can place it anywhere. And if you would place it even in the skin, it cannot destroy the skin, and it will even have beneficial effects because of the hyaluronic acid. Again, here, the treatment protocols and the injection possibilities. So you can inject it where you want, in a way, but always think about what you want to achieve. So if you want a lymphatic drainage, you have to be in the dermal or in the fat tissue. If you want to destroy the fat, stay in the fat tissue as well. Here, for example, you can even use it under the eyes. I like that treatment because it's just like really safe. And here, patient of mine where I did the injection of the double chin after 1 injection, after the 2nd injection, you can see the jawline is coming back without doing anything in that area. And here you can see it also with a fellow colleague of mine. So nice reduction of the adipose tissue, and also here it's an ongoing process and it will get better over time. And this is really something that you will see also with your patients. But sometimes it takes a little bit of time. The Cellbooster is something where we have clinical proof and where we have scientific backup. So this is really important. And here, for example, are the articles that has been published. And you can also see that the company is really behind it and trying to deliver really nice results for us as well. Because as Mr. Moses already said, Switzerland is a country which is known for quality, which is known for the watches, which is known for delivering really good results. And by this also you can say this is the same also with the Cellbooster, because we have really quality behind it, and this is really the important thing. So in the course of time, I will go a little bit further and faster through the presentation, because this is something which you already know. The injecting techniques are several options what you can do. Again, just always for beneficial effects, 3 injections, 2 weeks interval, and then you will have a really nice result. And it doesn't matter in which way you inject it. Do what you feel safe about, and then you will also have really nice results. But also remember what you're attacking. So lift deeper if it's for the scars. Glow superficial if it's for the pigmentation. Glow in the mid or deep dermal if it's reduction for the erythema. And you can also do lift superficial depending on if you want to stretch the small wrinkles around the mouth area. And you can combine the whole range within each other in one treatment, no problem at all. And even if it would go in the same layer, it's definitely possible. This is what I wanted to maybe talk about a little bit, because I like to combine a lot of things. And PLLA, for example, is something I love because it's a biostimulator. But the problem is most of the patients don't understand the idea behind the biostimulator, because they want direct results. So if they leave the praxis, they look in the mirror and tell me, oh, I don't see anything. And that's how I came up by combining these two things, by having an effect on the collagen directly, with a cell booster lift, and then having an effect later on with a PLLA, which will bring the collagen gradually over time with a better effect than there. And so this is really something that you can combine really good in one session. And this is something that I think even here, for example, in Indonesia, it's something that the people like a lot. I think this is something where you can benefit very, very good. The only importance with the PLLA is, but I think you know that, you have to place it deeper. So don't be fooled to inject it too superficial, because then you might be in big trouble. So really, really important, bring it as deep as you can, because superficial injections with the PLLA might not have the desired effect. But if you layer it with the cell booster, you will have a direct effect with the cell booster and an ongoing process effect then with the PLLA. And here the results of the combination. And you can see how this should be a video, but how I placed it. So go deep inside of the dermis and then place the product there, and then superficially layer it with the other options. So that was it. So thank you for your attention.